Hi, this is The New Norm. I'm Dr. Lou Graham. This program is brought to you by Midway Dental and Catapult Education. So one of the big perplexing questions as we've continued to go through this COVID virus is, why do some people get sick and others not sick? And why do some really get super sick or die? We've been suspecting genetics has a play, and the most recent study out of the Journal of Microbiology is based on a study out of the Oregon Science University, or Health and Science University. So they've done a study where they're looking at HLA genes, which are part of the immune response in general. And what they have found is there are variations in how HLA genes are patient by patient. And they're finding these variations can actually have a direct role in each patient recognizing the invasion of the virus. So those that have a variation may be far more predisposed to the dire consequences. This is huge. To me, it's huge because openly, if you now know that someone is predisposed based on their genetic immune response, you now know that if someone's COVID positive through a test, you would want to do this gene test. And they're saying this gene test is very inexpensive and easy to do. So now you would know which patients ahead of time, and potentially, if there are treatments coming out, you could start these treatments earlier or at the appropriate time. Or let's say someone's not COVID positive, but we're testing everybody for the gene variation. And as we go into the vaccine era, those that have this variation that make them predisposed to problems, they should be vaccinated first. I just love how we continue to learn more about this virus, and meaning this is where we have to go to be safe and be smart. Okay, with that all said, as our update, it's Joe Rossi time. So Joe Rossi owns his own firm now, over 10 years. I'll let Joe explain what his firm and what he does, and then we'll get into the COVID virus, particularly how he sees what he does and its relationship with right now where we are with the pandemic. Joe Rossi, welcome to the show. Tell us what you do.
Hey, Lou, thanks for having me. It's a great honor here. We are practice brokers exclusively for dentists, specializing in real estate and practice transitions. We help you sell your practice, purchase a new practice, start, expand, relocate, negotiate lease renewals, and help you buy and sell your real estate, and do it exclusively for dentists.
Love it. Okay, so Joe, I'm just going to go right into lease and rent. We're going to go right into this. So here I am. I haven't been working in a month. I'm basically unemployed, like most of the dentists have been, and rent comes along. What should dentists be doing? Now, I've already had to go through it for April. What should dentists be doing, Joe? What are your thoughts on this?
Yeah, well, first you need to be communicating with your landlord. Communicating as much as you possibly can, and trying to work out a solution that's, amendable to both parties. But the key is communication and empathy. You have to let your landlord know that you guys are kind of in this together. And I think if you have that right approach with the landlord, they'll be willing to work with you. But landlords, they vary in scope. Some are the answer is no, 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 and some are very easy and are willing to work with you. But again, they're all different. So we're seeing stuff all over the board.
So here's my question. So I have my Catapult group of colleagues, and this is how we communicate. And we go, what's a good deal for a landlord to do versus a bad deal? Obviously, Joe, a bad deal is they want their rent fully paid this month and in May, and everybody's a little tight on cash. I know that's a bad deal. Yeah. So let's start there. Let's say, Joe, and then we'll get to better deals. Let's say someone doesn't have the money. There are a lot of dentists out there. This is hit at just a bad time. Nobody was ready for this. Let's say they just started out. They don't have the money. What should they do if they don't have the money?
If you don't have the money, don't pay the landlord. And the landlord, they're going to try to scare you and say we're going to force eviction on you, which I don't even think they could do right now because most states have moratorium on evictions. But if you truly do not have the money, don't pay the rent, and your landlord is going to continue to tell you you have to pay. But once the landlord knows that you're not going to pay, you'll see the landlord have a different tune. And the landlord, once they know they're not getting their rent, it's going to force them to work something out with you. Realistically, them evicting you just isn't a likely scenario. So if you don't have it, don't pay.
Exactly. Because honestly, okay, I mean, I think dentists make great tenants because we don't move out. I think we're great tenants, are we not?
Dentists are going to be, top of the line tenant, especially now. I mean, other retailers, like anybody who sells any item, clothing, all those are very, very hit even much harder than any healthcare tenant. And restaurants are hard to begin with as tenants, but the COVID has really damaged their credibility with landlords and their ability to pay the rent. So you have leverage with the landlord.
Okay, so let's go back to a good deal. So a bunch of my colleagues in Catapult, they have landlords that say, you know what, whatever you don't pay us now, we'll defer to the end of the lease and extend the lease, let's say 3 months. So whatever you can't pay us, we'll defer your lease further. Is that a good deal?
That's a great deal, and that's the most common solution that we're seeing, and it's a great deal. And the longer they get you, the longer they let you pay the rent, the better for you. Some landlords are asking for it to be paid back by the end of the year, but you want to defer the rent as long as possible, and I would say that is a good, fair deal.
Okay, so basically, I'm going to ask you then this. Okay, so a good deal would be either to defer it over 20, let's say, can I defer the payments, whatever I haven't paid, can I add that in a deferment method throughout 2021 when I'll do business? I think that's a fair way also. Yeah. Okay, you agree with that?
100%.
Okay, so so we've covered rent, I think, pretty well. A couple of good ways around it. And then we talk about, is this a good time to talk about extending your lease or lease options? Tell me if this is a good time. I know it's crazy, but I think people are readjusting. What are your thoughts on that?
Yeah, well, I think anytime you're talking to the landlord, some dentists will never talk to their landlord. This COVID has really forced landlord and tenant to talk to each other, so you might as well take advantage of it. And if you can see yourself in your space for the next 5 to 10 years, now would be an excellent time to extend your lease out further. Landlords are going to be much more willing to give you incentives and lock you into good rates for the long term. They don't want to lose any more tenants. So I think right now, if you're happy with your space and your lease, it is an excellent time to renew your lease out. And I think you'd get more incentive than if you did so pre-COVID.
I'm going to go back to this in a second, but Joe, doesn't your firm, one of the things you do is you can work with dentists, because I didn't, and I made a big mistake if you ask me, but I've made plenty. Your firm really, with no upfront fee, would help renegotiate those leases for your clients. And basically the client then, if they get a better lease in their savings, part of that savings would go to you, but there's nothing up front. Is that kind of how it works with your firm and other firms?
Yeah, that's how it works, Lou. The landlords pay the fees to renegotiate your lease. It's important that you have somebody who's an advocate for you that can speak the landlord's language. You got to think some of these landlords have negotiated hundreds of leases, and just slight modifications of that lease could add up to hundreds of thousands of dollars in the landlord's favor. So it's important that you have somebody who can speak the landlord's language and then advocate for you. And our lease renewal services, if we don't save you any dollars, there's no there's no fee charged. So it's really
I
a
love that.
no-lose.
Yeah.
It's a no-lose
Yeah.
situation for you. But
Yeah.
be
When
careful.
I renegotiated my lease, I didn't have help, and I know I could have done better. So I would absolutely tell everybody out there, whether it's Joe Rossi or another company, I would get guidance no matter what. Okay, Joe, so you're out there. I think dentists are now looking at, okay, do I really want to extend my lease? Do I want to stay here? My place is getting a little old and dumpy, or I just built this out. Maybe it's a good time to negotiate. What are you seeing as far as how are dentists thinking in this COVID crisis? And I'm going to bring this up. I've seen dentists in their 60s now going, I don't know. I don't know if I want to deal with dentistry. I've seen younger dentists going, is this a good time to make a shift? What are you seeing out there and your colleagues in your line of business? What are you seeing out there? How are dentists thinking?
Well, we deal with doctors who like to start their own practice, so we're probably dealing with the more aggressive and optimistic doctors.
Okay.
What they're thinking is ranging greatly, and it depends on the position they're in and their age. You know, for example, we've had an influx of doctors who have been on the fence about selling their practice for, I don't know, the past 12 months, and something that happened with COVID happening, it really sparked them to like get going on their practice and like get going and getting it listed and prepping it for sale. And I think a lot of it's, you know, maybe they don't want to deal with this uncertainty and don't want to deal with another downturn, and they just, something sparked them. They're ready to sell.
So with that being said, I know there'll be a lot of DSO activity coming into the marketplace, but also what about associates and dentists who now may look at this as an opportunity to go, you know what? Or they're working at a DSO. Maybe they're looking at going post-COVID. Is this a good time for us to start exploring and expanding into dentistry and self-ownership? Are you seeing any of that?
Yeah, well, I think it's a good time just because there's going to be more practices on the market, and pre-COVID, it's been a very heavy, you know, seller's market. We've had 10 buyers for every one practice for sale, so I think that's gonna kind of shift a little bit, a much needed shift, and a lot of our associate doctors are out of work right now, or they don't know if the office they're working at is going to continue to be able to support them. They may not have enough value to support them. So it's like almost the younger doctors are forced into kind of controlling their own destiny and looking at opportunities just because they don't know if their job pre-COVID is still there. So it's kind of like a forced reset, re-examination of the opportunities that the market has to offer.
Got it. Okay, so let me just ask you this. Any other points that I have not grilled you on this morning? Any other points you want to make?
No, I think we covered. what we wanted to talk about. I think it's pretty covered.
Great. So here's my summary of this. If you're in the middle of rent, you know, your rent is due, go with what Joe Rossi's talking about. Talk to your landlord. And if you're in dire straits, as Joe says, then maybe you just don't pay and you bring the discussion forward. I think that's great advice from Joe. And really, we talked about deferring payments, whatever you can afford to pay. Let your landlord have that, and maybe you defer the rest till 2021 over 12 payments. Or as Joe said, some, like in Catapult, you extend your lease 3 more months, covering for what you didn't cover. Joe also covered, it's a great time to talk about whether you want to extend that lease and maybe some options and getting some help, like with what Joe's company does. But lastly, I just think this is a recheck time. Where are you? October's not going to be far away. I think things will be better. I do. I know there'll be a second wave, but I think we'll be gearing forward. And there'll be a vaccine coming, and we'll get through this. But now is a recheck time, and I think that's what today we covered with Joe. Associates are rechecking, owners are rechecking, and I think this is just a very interesting time in the COVID era. This is the new norm. Dr. Lou Graham, stay safe and be smart. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.